Today I will be discussing the article titled Independent and Combined Effects of Physical Activity and Weight Loss on Inflammatory Biomarkers in Overweight and Obese Older Adults. This article was written by Beavers et al. In 2013. To start with a background, chronic low-grade inflammation is associated with advanced age and adiposity. The inflammation is also shown to predispose individuals to several chronic conditions, including cardiovascular disease, diabetes mellitus, and physical disability. Thus, the inflammatory pathway is a potential therapeutic target for lifestyle interventions designed to reduce disease and disability in older adults. A large body of cross-sectional evidence reports that greater physical activity is associated with lower systemic inflammation, but the same effect has not uniformly been seen in intervention studies. Data from several small-scale intervention studies suggest that exercise training diminishes inflammation, but results from large, with about 20 subjects in their samples, randomized controlled trials designed to definitively test the effects of greater physical activity on inflammation are inconclusive. One factor that may confound the relationship between exercise and inflammation is weight loss, because weight loss can accompany exercise training and is correlated with improvement in the inflammatory profile. In several observational cohort studies, adjustment for adiposity, most often measured according to the BMI, attenuates the strength of the relationship between inflammatory markers and physical activity. The purpose of this study was to determine the independent effect of long-term physical activity and the combined effects of long-term physical activity and weight loss on circulating levels of inflammatory biomarkers in older, overweight, and obese community-dwelling adults at risk for CVD. The study was conducted in North Carolina and consisted of 8 waves of subjects. Overall, there was a total of 193 females and 95 males combined for 288 total patients. The major inclusion criteria consisted of ages 60 to 69 with a BMI greater than 28 kilograms per meter squared. The patients also had self-reported mobility limitations, sedentary lifestyle, evidence of recent CVD incident, or metabolic syndrome diagnosis. Subjects were randomized into 3 groups, and the primary study was the time to complete a 400-meter walk. Physical activity intervention consisted of a combination of walking and interactive group-mediated behavioral-focused sessions and were divided into 2 phases. For the first 6 months, 3 group sessions, each of 90 minutes in length, and 1 individual session of 30 minutes in length per month were conducted in supervised settings. Participants were asked to walk 30 minutes on most days of the week with a goal of 150 minutes of aerobic or walking exercises per week at a moderate level of intensity. During the next 12 months, the frequency of contact was reduced to 1 group session and 1 telephone contact per month. Discussion mirrored check-in during the intensive phase, which was the first 6 months. Participants continued with the walking program. The combined intervention program of physical activity and weight loss involved the previously mentioned 48 sessions that were included in the physical activity program in conjunction with the dietary weight loss. The weight loss goal was to reduce caloric intake to produce a weight loss of approximately 0.3 kilograms per week for the first 6 for a total loss in mass of 7 to 10% of initial body weight. During the weight maintenance phase, participants were encouraged to continue weight loss as long as their BMI was greater than 20 kilograms per meter squared, but the primary focus was the weight maintenance. A successful aging health education intervention was used as the active control. Participants met in groups weekly for the first 2 months, monthly through the 6th month, and bi-monthly until the end of the study, for a total of 18 sessions. Sessions included health topics relevant to older adults, such as how the body changes with aging, preventing or delaying disease, and eating for good health. Participants enrolled between January of 2005 and April of 2010. Baseline assessments included a self-reported demographic, medical history, comorbidity information, measured height and weight, physical activity energy expenditure, and the time to walk 400 meters. Follow-up visits occurred at 6, 12, and 18 months. Accelerometers were used to assess physical activity in all participants. Participants were asked to wear the accelerometers for 7 days immediately after the baseline and at 6 and 18-month assessment visits. Intensity levels of 3 to 9 were classified as moderate to vigorous, which was consistent with the metabolic demand activity for this age group. 12-hour fasting blood samples were also collected. This was done at baseline, 6, and 18 months, and occurred at least 24 hours after the last acute bout of exercise. Table 1 shows the mean and standard errors for all inflammatory biomarkers in each intervention group over 18 months according to the time point. There was no significance among these numbers between the groups. However, as seen in Table 2, when researchers adjusted for baseline biomarker, wave, sex, and visit, leptin and high-sensitivity interleukin-6, or high-sensitivity IL as described in the chart, showed a significant intervention effect. When comparing intervention groups, these two biomarkers were significantly lower in the combination physical activity and weight loss group when compared with physical activity alone or the successful aging control group. Further adjustment for baseline and follow-up weight allowed the previously significant intervention on these biomarkers to shift to non-significant. There was no evidence of a differential treatment effect according to baseline biomarkers. Although mechanisms by which weight loss contributes to improvements in the inflammatory profile have not been fully understood, researchers believe it is likely that reduction in excess adipose tissue plays a role. It was previously documented that individuals with more adipose tissue have higher systemic levels of inflammatory biomarkers. In a study examining the effect of surgical removal of fat mass on inflammation, it shows a direct and significant correlation. Significance is suggested because of the reduction in circulating inflammatory biomarkers following a targeted reduction in fat mass. Collectively, this data suggests that obesity is characterized by a state of chronic inflammation that is related to the amount of stored body fat, and that the reduction in body fat mass is an effective means of reducing this inflammatory burden.